I do a conceptual assessment of consciousness, and then I explore the practical issues related to consciousness assessment, especially in non-behaviorally responsive patients, so in disorders of consciousness. So I've been exploring both conceptual and practical issues related to consciousness. Specifically, I focused on the problem of communicating with unresponsive patients, with behavior in unresponsive patients, and then I explored also issues related to addiction, because starting from the general conceptual model of consciousness I developed, I tried to see what are the possible practical implications of these models. And so I focused specifically on disorders of consciousness on one hand and on addiction on the other hand. I think that the most pressure questions concern the increasing impact of science and technology on our ordinary life. If you take, for instance, the example of artificial intelligence, it's becoming ubiquitous, so to say. So our life is even more and more affected by artificial intelligence, both our emotional life and also our relationship with each other. So these are the kind of questions that we need to assess. Again, I think the most pressing question have to do with how to translate to the benefit of society, for instance, how to find, if possible, new treatments for psychiatric disorders, for instance, and also new way to assess residual consciousness in disorders of consciousness patients. I think that this is the direction to take for the project. Well, there are experiments out there from cognitive neuroscientists and also computer scientists how to detect residual cerebral activity through, for instance, magnetic resonance imaging, and how to develop brain-computer interfaces technology to interact with the brain of these patients. So there are some experiments showing the feasibility of this possible new kind of communication, even though it is, of course, very complicated, very difficult, and at least for now, it's not translated in broad clinical application. But there are some promising results out there.